Okay, this video is going to be about how to prevent a heart attack. Okay, I'm still wearing my Irish tie because I got St. Patrick's Day coming up. Until then, I got my green suit and my Irish ties, green ties every day. Okay, so what is this about? How to prevent a heart attack. What I would say, if you want to prevent a heart attack, step one would be learn Esselstyn. Okay, Esselstyn writes for the common man. His background, he's sort of like a cancer surgeon, endocrine surgeon, and he's just, I spoke to him actually directly about this exact subject. He feels like the only thing you need to tell a patient is what they need to know to get better. And what they need to know to get better is that a low-fat diet will optimize endothelial, arterial lining cell production of nitric oxide, which is a vasodilator, and it's an anticoagulant. It prevents platelets from clotting. So if you just tell them that and they actually do it, they're probably going to get better. So he says that's all you got to do. And he's actually right. He has great results. But I would say, you know what? For some people, they're going to want a little more than that. And that's kind of where I come in. I got a lot more training and knowledge and experience in vascular disease than he does. But mine comes from a different area. Mine comes from doing balloon angioplasty, stenting, and then from looking at all the images all the time. He's got more experience, nuts and bolts of just talking to people about getting them started on changing their diet. I talk to lots of people, but he was talking to people who they travel to see him and they want to get better. Whereas, 99% of the people I talk to, they're not interested in the vegetarian diet. I talk to them about it, but they're like, oh, well, so it's much, if the person has already made up their mind, then you just got to show them what to do and they'll do it. But if they haven't made up their mind or they're not interested in it, it's almost like a waste of time. So anyways, what I'm trying to say is I go into far more detail. So for somebody who wants to get better faster, wants to be aware of the nuance, and I summarize it in this book, Prevent and Reverse Stroke and Heart Attack. I also wrote another book here called Prevent and Reverse AFib and CHF. And I'm going into tons and tons of nuanced detail stuff. Basically, what I talk about is way beyond all the doctors, okay? He's talking at the level of a non-doctor, a common patient, whereas I'm talking at a level that's way above the typical doctor, way above even the AOAs, okay? Oh, I had a little disclaimer in here, and I'm basically saying, look, if you're taking any medicines for hypertension, for diabetes, for anticoagulation, you need to work with your doctor to titrate your dosages. Otherwise, you could be taking too much blood pressure pills and be hypotensive, pass out. You could be hypoglycemic because your diabetes and your hypertension are going to get better so fast, most likely, that you're going to have to lower your dosages, so you got to talk to your doctor. And then I always put some little joke in there. I said, this is for educational purpose only. I'm not your doctor. I'm just a genius with no social skills who spends all his vacation time writing books like a mope. It's about right. All right, now we got to look at the picture of the crucifixion of Christ and the Holy Grail. So here is Christ on the cross, and the Roman soldier Longinus passed his spear into the chest of Christ, and it bled. One of the angels caught the blood in the chalice, which was the Holy Grail, the cup that Christ had used previously, the day before at the Last Supper. And it's said that the Holy Grail, whatever you touch it to, will cure any disease, any wound, okay? And these are the 5 wounds of Christ. So number 1 is the wound in the side, then a wound in each hand, then a wound in each foot. Those are the 5 wounds of Christ. There's a good thief who repented at the last moment and said he was sorry, and he was forgiven, sent to heaven. So that's why Protestants say you can be forgiven by faith alone. The bad thief who did not repent. And the Catholic rule is more of, you better do some nice stuff too. You need works and faith, as like the book of James says, not just faith alone, like Martin Luther proclaims. But anyways, the 5 wounds of Christ and the Holy Grail, that's what you need to know. Painting by Gaudenzio Ferrari. Okay, so then this is what I call the 5 wounds of the village idiot. Number 1, they go for cardiac cath, right groin puncture wounds, common femoral artery, common femoral vein. Then they get a buzzsaw down the middle of the chest, and that's wound number 2. Wound number 3 is right internal jugular vein. They drop a swan down there to measure pulmonary artery pressures, swans, wedge pressures, okay? And then they're going to get a mediastinal tube and a chest tube. That's your typical CABG, coronary artery bypass graft. And the reason why I jokingly call this the 5 wounds of the village idiot is because there's like next to nothing for longevity out of this. You can get relief of cardiac angina but coronary artery disease is always diffuse. So why would anybody want to go for a cabbage, which is going to cost about $200,000? Stents cost about $40,000 a piece. When all you got to do is go low-fat vegan for free. It's freaking stupid, okay? Don't get me wrong. Sometimes you need cardiac surgery for a valve. Sometimes you've got a real complicated situation. Maybe you've got a severe indwelling stent stenosis and they want to bypass distal to it. And, you know, there's little variables that can make it complex. But in general, fix the damn thing with diet if you got a brain in your head. Why wouldn't you want to do that? Esselstyn said he's never in his life seen anybody have a cardiovascular event if they actually followed his diet. And here is the round table of King Arthur, where they had a vision of the Holy Grail. It came into the room in front of them, and they all saw it, all of King Arthur's knights. And as soon as they saw it, they proclaimed, "This is our destiny. We must seek the Holy Grail and try to find it." The story of the Holy Grail and how it got to England is that Joseph of Arimathea, who had helped take Christ down from the cross after he was died, that he subsequently brought the Holy Grail to England, you know, like to Glastonbury is the legend as it goes. So that's how the English felt that the Holy Grail was in Britain, okay? Now, it was thus proclaimed amongst the knights that we shall go on a quest, all of us, to find the Holy Grail. Even though they were informed right from the beginning that only the knight who is worthy, who is pure, like Sir Galahad, would be able to find it. But all of Arthur's knights, you know, decided to go on the quest for the Holy Grail. And King Arthur was actually sad because he knew that some of them weren't coming back after this big quest. But here it is, painting by Edwin Austin Abbey. And here are the knights leaving to go. The knights are departing, and their fair maidens, they're saying goodbye as they go on their quest to find the Holy Grail. Painting by Edward Burne-Jones. Sir Galahad and Sir Percival were the ones that were most pure and had the best chance to find the Grail. And here is Galahad, who appears to be guided by angels as he seeks out the Holy Grail. Painting by Arthur Hughes. And the reason I'm going through all this Sir Galahad stuff about getting better is because I'm saying is you have to make yourself worthy, okay? You can't just be the typical dummy and expect your doctor to save you. You have to do what it takes. You don't have to be a genius or a rocket scientist. Just eat low-fat vegan diet with no oil, no caffeine, okay? No nuts, no seeds. Esselstyn says no nuts and no seeds, okay? No avocados, no caffeine, no cigarette smoking, no alcohol, all right? And then what I tell you is that atherosclerosis, what is it? It's just a blood clot. And again, this is way over the head of regular doctors. You want to have a laugh, go ask your doctor what's atherosclerosis. And they'll go, well, it has something to do with cholesterol. It's a blood clot, okay? You need to know that to start thinking intelligently about atherosclerosis. Atherothrombosis theory, as clarified best by Gregory Sloop, MD. But they knew this back in the 1850s, okay, that atherosclerosis was a blood clot. It just got kind of covered up so they could sell statin drugs and say it's all due to cholesterol. Cholesterol is an atherosclerosis risk factor because it causes blood to clot. It sticks the red blood cells together in the form of chylomicrons, triglycerides, and LDL cholesterol particles. Anything that makes a blood clot is an atherosclerosis risk factor, okay? Can atherosclerosis be reversed? Of course it can. Why do you think I'm writing this book and giving this lecture? Okay, and you can certainly stop its progression. So here's an atherosclerotic plaque. You form an acute clot, and that's this soft plaque right here. The macrophages come in and they try to, eat the soft clot and remove it. You have dead tissue in the necrotic core of cells. That can be reversed. Acute clot can be reversed. Hematomas get reabsorbed all the time. The lipid core, that can be reabsorbed from the phospholipid membranes of the organelles and the plasma membrane of the cells that clot. Fibroblasts are going to come in and start laying down fibrous tissue, collagen, okay? And then you got calcifications. Now, I know there's some people, they've even sent me emails saying, you know what? Calcium can be removed, and you give people a lot of magnesium and you can start seeing calcium partial resorption. Okay, fine, theoretically it can happen, but in real life I've never seen it happen. So while it's theoretically possible, you want to just start doing whatever you can to reverse it, which means eat the low-fat, low-sodium vegan diet, okay? And then there's more nuance to it than that, and we're going to start going into that. But there it is. It makes sense. Plus, as soon as you start following the diet, the endothelial cells will function better. Oh, one thing I forgot to say is you got EPCs, endothelial precursor cells, that circulate around in the blood. And so when the clot forms on the wall of the artery, they cover it up. And that's how it gets subintimal. You don't need all this fancy, complex, hand-waving arguments. Okay, now here is some of the work of William C. Roberts. He's the great cardiac pathologist, did autopsies like on 2,000 people that died of heart attacks. And what did he have to say? He said, well, gee, number one, atherosclerosis is always diffuse. It's always in similar severity in all the main vessels. So here's the main coronaries. There's two main coronary arteries, epicardial coronary arteries on the outside surface of the heart. There's a left coronary artery, and it starts out as the left main. The left main typically bifurcates into the LAD, left anterior descending, runs down the anterior septum between the ventricles. The left circumflex runs around the atrioventricular groove around the side of the heart. So that's the left coronary artery. Left main bifurcating into the LAD and the left circumflex. Okay? Then there's the right coronary artery. All right, and it's variable, which will give the main arterial supply to the posterior coronary artery, which can come off the left, and a left dominant circulation can come off the right, and a right dominant circulation. The point of the matter is he mapped it all out in 5 millimeter increments, and what William Roberts said at autopsy, and all the patients who died of heart disease, every single one of them had diffuse disease in every single segment of all three coronaries, and it was of similar severity throughout. So what that means is you cannot fix this with surgery or a stent because it's always diffuse. It always is. He said single vessel coronary artery disease is a myth. It's never just one vessel. It's always diffuse of similar severity in all the other vessels. So it might look like it's relatively focal on a cardiac cath where you're only getting a view from one angle, so to speak, or two angles, and you're not able to map it all out in 360 circumferential. So what he's basically saying is cardiac cath misses a lot of disease. You can do CT angiography, which helps show some things, but still, autopsy shows it better. And Dr. Roberts says single vessel coronary artery disease is a myth. It's always diffuse. And what that means is you can't effectively bypass it. You can't effectively stent it. You can only treat it with a drug or with a surgery, and why not treat it, or a diet, and why not treat it with a diet, because that works best. He also said that cardiac cath always underestimates disease, because when they estimate the stenosis in a segment, they do so by comparing it to the adjacent segment, which he said is always diseased. But they make the assumption when they make that comparison that the adjacent segment is not diseased. But it actually always is diseased, meaning that it's narrowed already at baseline. So the adjacent stenosis is actually worse than their eyeballing it measurement would suggest. And you can't tell which plaque is going to rupture and cause an occlusion. So what I'm trying to say is they don't even really know which plaque to treat with regard to preventing a heart attack. They can treat stenosis causing symptoms, cardiac angina, shortness of breath on exertion, dyspnea on exertion, chest pain on exertion, but they can't prevent that follow-up heart attack because they don't know where it's going to happen. Here's a book by Gregory Sloop, Blood Viscosity. That's the greatest book. He's a pathologist who figured out atherosclerosis better than anybody else, the pioneer of the atherothrombosis theory. Okay, and a lot of what that's about, you know, in the Bible and Proverbs it says fear of God is the beginning of wisdom. Well, understanding of the zeta potential is the beginning of wisdom with regard to atherosclerosis and blood flow and preventing a heart attack, okay? So you got red blood cells with negative charge on their outer surface. That is the zeta potential. The negative charge comes from the, like the sialic acids on the edge of the glycosaminoglycans. It also comes from the sulfates within the repeating disaccharides of like the heparin sulfates, and it also comes from the cholesterol sulfates in the plasma membrane outer lipid. But anyways, you got a negative charge on it, and they repel each other, and that's good. But if something big comes along with a positive charge, big enough that it can stick them together, it'll stick them together. Now the red cells stick together, and that's called blood sludge. It's also called rouleau formation. Rouleau means stack of coins in French, okay? All right, well, we're going to make that the end of part 1 of how to prevent a heart attack. I hope you found that helpful.